Hello there, welcome back to today's video. If you are new to my channel, you are welcome. Okay, please don't forget to subscribe, and to you, my returning subscriber, God bless you for always coming back to watch my videos. So in this video, I want to talk on the anatomy and physiology of the kidney. Okay, I just want to talk on what the kidney is all about and its functions. So let's dive into the video. The urinary system is made up of a pair of kidneys, okay, a pair of ureters, the bladder and the urethra. So the two kidneys form and excrete urine. This urine that is being formed is carried from each kidney through the ureter to the bladder, okay. So the urine is temporarily stored in the bladder before it is being voided out. So the kidneys are located on each side of the posterior side of the abdomen. Each kidney is being shaped, okay. So the functional unit of the kidney is called nephron. So each kidney contains about 1 million nephrons. So the nephron is made up of Bowman's capsule, the glomerulus, the proximal convoluted tubule, the lobe of Henle, and distal convoluted tubule. So let's look at the renal physiology, that is the functions of the kidneys. The first point I have here is that the kidney helps in the maintenance of water and electrolyte balance of the body, okay. So the proximal renal tubules, they reabsorb about 85% of the water that is being filtered by the glomerulus. So under normal conditions, all the glucose that we get from the food we eat, the carbohydrates, mainly the amino acids that we get from proteins, the potassium, bicarbonate, and about 70% of the sodium, they are being reabsorbed back by the proximal tubules. So another function of the kidney is that it helps in the maintenance of blood pH. So substance can cause the pH of blood to rise, okay, or fall. So these substances that can make the pH of blood to rise or fall, they are being removed by the kidneys. So substances of acid reaction are the waste products of protein metabolism. So these substances, they are urea, uric acid, and creatinine. So they are continually being formed, and so they must be excreted. And on the other hand, the alkaline reaction substances such as the salts of sodium, potassium, calcium, magnesium, and phosphorus, they are being removed too, okay, because if concentration of these salts becomes too high, okay, they are being also removed by the kidneys. Another function of the kidney is that it plays a major role in excretion, and the waste products of drugs which are being left in the kidney, they are later being excreted through the kidneys, okay. So toxic substances like that drugs, they are being rendered harmless in the liver, okay. All those substances that are being rendered harmless in the liver, they are also being excreted by the kidneys in the urine. So you can see that the kidney plays a major role when it comes to excretion. Then another function of the kidney is that it helps in the production of erythropoietin. This erythropoietin is a hormone, okay, and it is a substance that is necessary when it comes to the normal production of red blood cells in the bone marrow. So it is the kidney that is also being responsible for the formation of this hormone you can see that the kidney has many functions. Another function of the kidney is that it helps in reabsorption, okay? So the kidneys, they help in reabsorbing those substances that are needed by the body into the bloodstream. So there are some substances that, if not for the kidney, we'll be losing them on daily basis, but with the help of the Bowman's capsule, the convoluted tubules, each part of the nephron, they have roles that they play, so they play major roles when it comes to reabsorption. Another work of the kidney is that it helps in the concentration of urine, because the large amount of water that we drink, they are being filtered out through the kidneys each day, but it is only 1 to 2 liters that is being what? Being excreted as urine from the kidneys. Then another work of the kidney is that when it comes to filtration, the kidney also plays a major role in filtrating important things, okay, back to the body, and the ones that are not useful, they are being what? They are being excreted. So you can see that we have about 7 functions of the kidney, and it is not an organ that should be joked with, okay? So when tests are being done, like urinalysis is the basic test that we normally run when we go to the lab or our regular medical checkup. They always collect our urine samples and examine them. So when some things are being noticed, like when proteins are being found in urine, okay, that patient is being advised to run renal function test. If you can remember in my previous video where I talked about blood test abbreviations, I talked on the test that is being done called Electrolytes, Urea, and Creatinine. This test is mainly to assess the state of the kidney. So when this test is being done, you see the whole electrolytes there, the potassium, the sodium, the bicarbonate, chloride, okay? These are the major electrolytes that are being assessed during that electrolyte, urea, and creatinine test, okay? Urea also is being measured. When urea is measured, it helps to also know the state of the kidney. And another one is that creatinine, which is the main test of that kidney function, okay? I called it RFT in my blood test abbreviations. RFT, which is renal function test, and also you can also call the test electrolytes, urea, and creatinine. So we've seen that the kidney is a very vital organ that should not be joked with, okay? I'm advising people to always run these electrolytes, urea, and creatinine tests regularly, because from our explanation so far, we have seen that the kidney has a lot of functions in our body. It helps in maintaining water balance and electrolyte balance. That is why when people are having issues with the kidney, you always see them presenting with swelling, because the water is no longer being maintained, the electrolytes are no longer being maintained, they are not being filtered well, they are just passing through the kidney into the blood, without control. That is why people with kidney problem always experience swellings, okay? So the kidney has many roles. That excretion part is very important. That is why some people, when they are having these kidney issues too, you see that they hardly pass urine. When it comes to excretion, they find this difficult to excrete waste products, and all these things, they will accumulate and also result in swelling. So kidney is an organ that is very important in the body. We don't need to joke with it, okay? We need to pay closer attention to it. When you notice that the color of your urine is not that colorless, okay, it's not pale amber, that is the right medical term. Always drink enough water to flush your system. And when you keep doing that and you notice that the color of your urine the color still persisted being deep amber, okay, try and examine that urine to make sure that everything is in order. So that is why I said I have to come and talk on the anatomy and the physiology of this kidney, so that we'll have the primary knowledge of what this kidney is all about, and mainly its functions. They are very important, because when you know the function of something, it will make you to value it more, okay? Kidney problem is on the rampant. Even younger people that are less than 30 years are having kidney issues. So we really need to improve our lifestyles, okay? If you are a smoker, you have to minimize the way you smoke. If you consume alcohol a lot, you have to reduce your alcohol intake. Don't take drugs anyhow. Always consult your doctors before embarking on any medication, okay? So if you have watched up to this point and you have not subscribed to my channel, please consider doing so. And when you subscribe, don't forget to click on that bell icon. It will give you 3 options. Kindly click on all, so that whenever I upload a new video, you will be among the first people that will get the notification. Thank you, and see you in my next video. Bye.